Well, my dad always said no one would notice that I was missing any teeth if I kept my mouth closed, and that's kind of hard to do, you know.
We really don't have the money for dental coverage.
I realized that for a long time, I had been closing my mouth when I was smiling.
We would have to always handle an emergency. And usually the emergency was so costly that that's all you could handle.
Every patient is treated with respect and dignity and love.
Now I can chew my food and I can smile. It's just a real wonderful experience that I've had.
You want to give your kids everything, and it's frustrating when you can't provide it yourself, even though you're working really hard. We don't have any dental coverage, and we're on a really tight budget. We wouldn't be able to go to the dentist like we should.
People that are living paycheck to paycheck, it just takes a car to break down, a new prescription medication, a rent increase, and you're in financial disaster. So where's dentistry fit in? It doesn't fit in at all.
I take good care of myself. I haven't had a cavity in 30 years. But the work that I do need costs a lot of money somewhere else.
In Greater Nashville, there's 200,000 people that are deemed working poor. These people are working 40 hours a week or more, 2-3 jobs, and still can't afford dental care.
I had the, what the dentist had told me, the Mountain Dew mouth, rotten teeth in the front from drinking too much Mountain Dew.
He was sick a lot. He would miss a lot of days, stomach ache, headache, migraines, a lot of problems.
It's creating a huge problem for them in employment, missing days of work because of pain issues, and also being kept back from promotions and from working in front of the public because of the condition of their teeth.
My front tooth broke. I did not feel comfortable going to customers, even though I'd seen them before with a big gap in front of my face. I didn't want to smile, didn't want to talk to anybody.
Their quality of life can improve to such an extent that they can actually move out of poverty because they're able to get a better job. And the community is investing in them, helping them, giving them this 1 second chance to bring their oral health up to where it needs to be. The group of uninsured working poor is very diverse. Some are living at or below poverty level, which in Tennessee, for a family of 4, the poverty level is $19,000. They may have been TennCare patients as children, and then at 21, no more benefit and haven't been to the dentist since. Some have had dental care and because of a divorce or some other setback lost their benefits. For each patient that we work with over the year, there's another patient anxiously waiting for their turn to get the dental health care that they need. We could have 5 clinics like this and still not meet the demand.
I was missing quite a few teeth. I had a problem chewing my food. It caused me to have stomach problems, you know, bad indigestion. Interfaith made it available for me to get this work done, and I'm just so thankful. I wouldn't have been able to afford it any other way.
The dental disease and the decay rate we see is much more advanced than we would normally see in a private practice situation. So we have a lot of work to do on most of the patients that we see.
Poor dental health has been linked to heart disease and diabetes and other ailments, and having good dental care can really make a difference.
We teach basic brushing and flossing, give oral hygiene instructions.
They taught me, just like they were teaching a child, how to take care of your teeth, and they did a great job.
Education and prevention are just as important as treatment. We can fix teeth all day long here, but if people aren't taught how to look after them and aren't inspired to do their part, it's just going to be a waste of dollars.
The poor cannot afford a dentist. That's why this place is very important.
Here at Interfaith, you know that you're going to be taken care of. You know that you're going to be nurtured.
There's a whole community out there not being reached, and their teeth are rotting, they're in pain.
My family's on a healthy dental schedule now, and it feels good to be able to provide that for them when we couldn't.
By Interfaith Dental making a bridge for me, I was able to go places and smile again.
He's just seemed a whole lot happier, and he smiled a whole lot more.
I don't feel like, oh me, I'm out here because I don't have the money to go anywhere else, you know, because they don't make you feel like that.
I'm a lot happier now with some good teeth.
He hasn't missed a day of work since.
People are looking at me and not at my gaps.
Patients want to give you a hug, and you can see the excitement in their face. They may shed some tears of joy. It's amazing how much of the frustrations are eliminated when you take out the money side of the dentistry.
The volunteers get back way more than what they put in. My dentist told me he couldn't build a house. This is what he knew how to do.
Interfaith Dental Clinic has let me know that it's possible for me to be well again.
I stand in the front of the mirror and I turn and I smile.
I'm going to be having my 50th class reunion, so now I can just smile bigger than any of them.
I don't hesitate to smile. I'm not trying to hide my teeth anymore.
I love to eat, you know, and now I can, so it's made a big difference in my life.